Hello, everybody. This is Mohammed Kazi with a quick but important update with regards to some of the anesthesia resolutions that will be discussed at this year's House of Delegates in Nashville at the end of the month. Um, Based on numerous requests, we've decided to kind of summarize these resolutions in a manner that is concise and easy for membership to understand, especially since a lot of these resolutions have to do with anesthesia and would affect our daily practice. There were a series of anesthesia resolutions that have passed the 2020 House of Delegates as first read resolutions that are um, being presented at this year's House of Delegates, in which case, if they do pass, they will go into effect. The first one I want to talk about, and again, there's five main things that are being covered in these resolutions. The first one is Resolution B3, and it talks about the development of a survey that would be completed as part of the office anesthesia evaluation. This will take effect, if it passes, in the year 2023. And the survey would be a survey that we would have to answer and complete, and may have to do with the number of anesthetics and unintended events in our practices, amongst other types of data that would be collected as well through the survey. So it would require some type of record keeping in our practices. For states that do not have the office anesthesia evaluation, there would be a web application that the AMIS members would have to complete and submit their survey through. However, in our state, obviously, you guys all go through the office anesthesia evaluation. So one is the survey. Next thing, Resolution B4 talks about the development of what they call an oral and maxillofacial surgery anesthesia assistant certification program. This is similar to the dance program, but instead of being a dental anesthesia, the name is AMSA, which is an oral and maxillofacial surgery anesthesia assistant certification program. This entire resolution talks about the creation of such a program, developing guidelines with regards to the educational requirements of a program like this, and developing guidelines for appropriate testing measures for assistants that participate in this type of certification process. This resolution further states that by the year 2026, a designated assistant with current certification would be required. So by 2026, we would all be expected to be in compliance with this resolution if it passes. Verification of this is done through the office anesthesia evaluation, as well as an attestation that is required on the annual dues statement when that is submitted. So the survey, the AMSA certification program. The third thing is Resolution B5, which talks about the development of an anesthesia simulation training program for oral and maxillofacial surgeons that administer anesthesia in their offices. And this would take effect in the year 2026. So by the year 2026, all surgeons would have to have completed this simulation training and must maintain certification through retaking this certification training once every 5 years. Compliance with this is also verified through the office anesthesia evaluation, and failure to comply with this would result in loss of AMIS membership. The next item is Resolution B6. And this item talks about mandatory mock drills for the entire team at every office location. If this resolution passes in its current form, it would take effect in the year 2022, so as early as 3 months from now. And what this requires is pretty self-explanatory, but a mock drills to be performed at every office location for the entire team and to be documented in a log. And compliance with this would be reviewed at the office anesthesia evaluations, and also by virtue of an attestation on the dues statement as well. So we talked about the survey, the annual survey that would have to be completed, the AMSA certification program for the assistants, the anesthesia simulation training for the surgeons, and the mock drills, again, which if it passes would have to be done quarterly at every office location starting the year 2022. There was one additional anesthesia resolution which is being introduced this year for the year 2021. In that resolution B1, 2021 B1 has two components to it. One is it talks about that AMIS is to gather data from third-party entities such as private insurance companies to demonstrate the safety of the OMS practice model, anesthesia practice model. And the second component of this resolution B1 talks about a DARES reporting system, which is an anonymous self-reporting system for reporting unintended events. So DARES is an acronym for Dental Anesthesia Incident Reporting System. This is not mandatory, but members are encouraged to report unintended events through the DARES system. Again, it's anonymous and it's used to collect and analyze data to improve the quality of anesthesia care. Finally, there were two other resolutions that are introduced, not related to anesthesia, but related to the annual dues, and those are resolutions 21B3 and 21B4, and essentially what they're doing is keeping that informational campaign due increase as a permanent increase. So resolution B3 increases the resolution by $350 annually from $1,250 to $1,550, and resolution B4 would rescind the last year of the informational campaign and would rescind the $350 for the upcoming year, and that results in essentially the $350 being just a permanent part of the annual dues. That was a summary of the resolutions. Sorry for the slightly longer video, but again, 5 things: survey, AMSA certification program for assistants, anesthesia simulation training for the surgeons, mock drills quarterly, potentially starting as early as 2022, and then resolution B1, which talks about DARES, which is the anonymous self-reporting incident system. Hope this was helpful. We'll make the resolutions available through Jane and through the website. You would need username and password access for that component, and you can reach out to Jane with regards to that. Anyways, hope everybody's doing well, and we will see you at this year's annual meeting, the state's annual meeting. Have a good one, everybody.